Hey everyone, how's it going? Welcome back to Traumacist RX. My name is Freddie, I'm a critical care pharmacist, and in today's episode, I'm going to talk about stroke or CVA, cerebral vascular accident. So before we begin, if you're returning to the channel, welcome back. It's been a minute since I've done some solo content, so thank you for sticking around and supporting. And if you came to this video for the first time, thank you and welcome to Traumacist RX. I'm a healthcare channel that helps with explaining things so that way you can learn about healthcare a little bit easier. So in this video again, we're going to talk about stroke, which for me is important because in my role as a critical care pharmacist, I see a lot of stroke patients in our neurocritical care trauma unit. And unfortunately, strokes are a medical emergency that can be devastating to patients because if someone has a stroke, they're likely to not be able to do the things that they love, such as hiking, cooking, tasting things, eating their favorite foods and that sort of thing. And so I think that talking about stroke, some of the most common symptoms, and also ways that you, the audience, can identify this in the real world so someone can get help is super important. And hopefully you can help someone prevent getting some deficits from stroke in this video. But again, thank you for watching. And before we get into the video, make sure to hit the like button and subscribe button below. And that'll definitely help me get out to those who need this information. And yeah, we'll get into the video right now. Alright, so first off, let's go over some background about what is a stroke or cerebral vascular accident or CVA. So in general, a stroke is basically a blockage of blood flow to the brain. And as you may or may not know, when blood flow and nutrients are blocked in any part of the body, tissue cells in your body start to die. And unfortunately with the brain cells, you might have heard back in your biology class that brain cells don't actually grow back or repair themselves as well as other cells in the body. So that's why strokes are super important, because if blood flow is restricted, then brain tissue cells can die. And here's a little picture that I'll put maybe right here about different parts of the body that are affected by the brain. And maybe you can see, so if someone has a stroke in the front part of their brain, maybe they'll lose certain skills and be able to think cognitively, whereas other parts of the brain, maybe they won't be able to swallow, walk, and that sort of thing. Alright, so before we kind of get into some of the important symptoms to know to identify a stroke outside in the real world, let's talk about what is a stroke. So a stroke is a medical emergency. It affects over 800,000 and maybe like 1 million Americans in the United States every year, especially with COVID, and we'll get to that in a little bit. But basically, there are two different types of strokes out there that are kind of the main ones we see. The first one is an ischemic stroke, or a stroke where there's a blood clot that happens either caused by the heart or some sort of plaque in the brain from cholesterol. And basically what can happen is blood can block the blood vessels in the brain and physically stop blood from giving nutrients to the brain, and that leads to brain tissue death. The other way that strokes can happen are called hemorrhagic strokes, which are strokes that happen when the vessels in the brain burst or open up and blood leaks out of the brain. So that way basically the blood, instead of circulating through the different vessels throughout the brain, leaks out and ends up outside of the brain, which doesn't really help with giving nutrients to the brain cells. There is a third thing called a mini stroke, or a TIA, transischemic attack, which has symptoms like a stroke, which we'll talk about, but resolve themselves within 5 minutes or so. And these are sorts of mini strokes because they have the same symptoms as a stroke, and may be caused by people who have constricted blood vessels in their brain that kind of open up and close transiently. And so for these patients, if you know someone who's had stroke symptoms for maybe 5 minutes or so, they might have suffered from a TIA, and maybe they should talk to their doctor more about it to reduce some of the risk factors, which we'll go over in a moment. So the most common causes for strokes, either ischemic or hemorrhagic, actually have to do with some chronic diseases. Mainly if they are uncontrolled, such as having uncontrolled diabetes, hypertension, hyperlipidemia, or high cholesterol, not being able to take your medications for AFib, atrial fibrillation, which can cause clots, or the most common cause of clots from the heart to the brain. And even patients who have COVID are all at risk for potential strokes. So those are some things to think about. Make sure that if your family history is one that consists of history of strokes, you want to make sure that your diabetes is under control, hypertension, and all chronic diseases are also kind of looked at on a yearly basis. Some things that I always see commonly in the ICU are patients who either stop taking their anticoagulant medications and patients that also stop taking their hypertensive medications, because a lot of the times when patients have hypertension, they don't know that they're having hypertension. It's not something that's like symptomatic like diabetes. If you're hypoglycemic, you feel dizzy and fatigued, but with hypertension, hypotension, really the only symptoms for hypotension are weakness, but for hypertension, you can't really tell. So a lot of patients with those sorts of diseases, if they don't feel the symptoms, they're not going to take their medication. And unfortunately, after a while, your body kind of takes a beating from hypertension, having too high blood pressure, and that can unfortunately lead to a clot to the brain. So another thing to think about with most common causes for strokes are patients who are about to get a surgery. Sometimes the surgeon will ask the patient to stop, their oral anticoagulant or blood thinner, such as apixaban, Eliquis, Xarelto or rivaroxaban, those sorts of things, or even warfarin, for a few days before their procedure. And so it's important to talk to your doctor about having like a scheduled plan. So, for instance, if your surgery is on Monday and your doctor tells you, all right, Thursday before, stop your medication, you might want to just make sure that they go over the risk factors with you and make sure that is something for you to monitor and your family to monitor in case you get a stroke. So that's something to keep in mind. And also, if you do hold your anticoagulant medication, you also want to come up with a plan with your doctor on when to resume that medication, because that's another thing that happens in the ICU. Unfortunately, patients have their surgery and their doctor either doesn't explain to them very well, or they forget to explain that, hey, after day 2 after your surgery, let's go ahead and resume your anticoagulants. So sometimes I'll have patients who had a surgery in March and they won't remember to start their anticoagulants until they get into the hospital a month later because they forgot or didn't receive that information from their team. So something to ask your physician about or surgeon about if you're going to have a procedure is something that I see a lot, unfortunately, in the ICU. Other common causes are patients who are on birth control or hormonal sort of supplements and substances such as estrogen, Premarin, those sorts of things, because they can increase your risk of bleeding, increase your risk of clotting as well. And if you're going on a long plane ride or some sort of trip or something where you're immobile for a long period of time, 4 hours or so, you might want to just talk to your physician about some of your risk factors, maybe exercises you can do during the plane ride or boat ride or whatever road trip that you're going on, so that way you can stay, prevent yourself from getting like a clot. Alright, so now that we know what a stroke is, some of the most common causes out there, let's talk about ways that you guys, can identify strokes in the real world and hopefully get someone help as fast as possible. So this leads me to this acronym called Be Fast. So I want you to think about getting someone help as fast as possible, especially to help prevent too much brain tissue loss. So B stands for balance, also dizziness and weakness. Some people will walk all of a sudden fall or collapse on their legs, and that's because maybe the stroke is affecting the balance part of their brain. E stands for eyes. So a lot of times people will have loss of balance, weakness, and also blurry vision, even though they may not wear glasses. And even if they wear glasses, maybe their vision will still be blocked, or they won't even see from one part of their one eye. So sometimes people will have like left eye blindness all of a sudden, and that might be because they're having a stroke on the right side of their brain. So F stands for facial droop. So depending on what side of the stroke is, the patient might have a droopy face on the opposite side, so it'll kind of look like this. And unfortunately, they won't know what's happening to them. You, as someone visualizing their face, will be able to tell. And one way to tell that we do in the healthcare field is to have the patient smile like this. And unfortunately, when they smile, this side of their face will be up and this one will be down, kind of like that. So it's a little goofy. But if you think someone's having a stroke, 3 symptoms so far. Balance, can they even get up and walk? Blurry vision, and then also if they smile and half of their face isn't like moving, maybe they have a stroke on the opposite side that is causing their facial muscles to not move. Alright, so B, E, F is face, A is arms. So if you have someone either lift both of their arms, they might think that they're lifting both of their arms, but unfortunately only one of their arms will be lifting. So again, opposite side of the brain might be telling that there's a stroke on that side of the brain. Next one is S. So S stands for speech. So a lot of the times if there's a stroke in the speech area of the brain, Patients won't be able to talk, they won't be able to understand what you're saying, or they might be saying something like a word salad, so random words that they're trying to communicate but are not making a cohesive sentence. So you might ask someone, hey, are you okay? And they'll say something completely random that they don't normally say, or they might not even understand what you're saying and look confused or not even know how to respond to you. So that's, speech is S, and then T is time. So time, all I want you to do with T is note the time that they had the stroke and also the last time they were seen normal. So this is going to be super important to tell the ambulance when they come, and to make sure that if you see these symptoms, be fast. You want to call 911 immediately, get that patient safely either in a chair or in a place where they won't hit their head or, vomit on themselves and aspirate some stuff. All right, so once you identify some of the symptoms and you're acting fast, you're waiting for the ambulance, a couple of things to think about here, right? So again, part of the brain of the patient is not working properly, so it might be hard to move them to certain locations. I would totally recommend just making sure to have the patient either sit in their chair if they were in a chair, or have someone help you carefully move someone to like a safe place. What I would not recommend is trying to drag someone into your car and driving them to the hospital, and actually just waiting for the ambulance to come, because we have things called code CVAs, where ambulances, when they pick up the patient, they assess the patient for a stroke. They do all the be fast sort of checking. And when they identify someone with a stroke, they'll take them to the closest stroke center, if possible, to you. And what they'll do is call the hospital and say, hey, we have someone with a stroke. Can we initiate a code CVA? So if you hear that, that means the hospital is ramping up. They're going to call out all the specialists, the neurologists, pharmacists, and say, hey, we have a patient here. They're 120 pounds. They had a stroke an hour ago. Let's go ahead and prep everything to get ready. So what they'll do is they'll prep the hospital, so when the patient actually goes to the hospital, they're going to go straight to the CT scan, get a scan of their head to make sure if it's an ischemic or a hemorrhagic stroke. They'll do a test on the patient to see, if they can identify certain pictures, if they can talk, lift their arms, that sort of thing, so they can do an initial assessment right away. And basically, if you weren't to get into an ambulance to move the patient, it will take a little bit longer to get all of those processes started. So definitely rely on the ambulance to take them to the hospital, because they can get fast help and save as much brain tissue as possible. So some other things to think about once the patient is in the ambulance. You want to make sure if it's your relative or someone that you take care of, you want to get a list of their most active medications. You want to make sure that the physicians and everyone knows previous or recent surgeries and like the timing of it, the type of surgery. You want to know if they have any upcoming surgeries where the patient maybe held their medications like anticoagulants. And the last thing I would say on a quick sort of like fast moving thing is to think about any patient allergies. Do they have any allergies to any contrast if they've had it in the past? So when we look at patients, sometimes we put contrast in their blood so we can see certain things. You might want to mention that. Any allergies to any other medications, antibiotics, that sort of thing. So that way, since the patient will not be able to talk or speak for themselves, you can try and get that information all bundled up, and that way the team can treat the patient as best as possible and not delay care. So I know that was a lot of information, but I hope you learned something today, and maybe you can use this information, again, be fast, to help someone out there, so that way maybe, if someone has a stroke and they love to hike, they don't lose that much brain function and they can go back and hike and do the things they want to do after a stroke. So I hope you learned a little bit in this video. Maybe I'll do another video about what it looks like when a patient actually goes into the ambulance, and then when they get to the hospital, what to expect. And maybe I'll do another video for you, the family member or friend who sees someone get a stroke, like what happens after. And so stay tuned if you like this sort of healthcare content. Make sure to hit the like button, subscribe button below. Comments anything below that if you've had any experiences, that would be interesting to share if you're willing to share. And anything you think I might have missed or some suggestions for future videos. All right, hope you enjoyed this one. I know it was a lot of information, pretty quick. And I'll do more videos on this stuff if you like it. All right, take care, like and subscribe, and stay safe out there. Hey everyone! If you like the video that you just watched, make sure to subscribe by booping on Carmel's face, and also click any of the videos here. Alright, take care. Say bye, Carmel!